Transplants are a very effective and permanent way to replace hair. The idea is to take donor hair follicles from the back of the head, where they almost always grow for life, and move them to the top of the head, where they often fall out. What usually limits the amount you can transplant, though, is the donor area. Here's a better way.
A couple of transplants, a couple hundred apiece. A couple hundred grafts.
And today, Charles is having another hair transplant to fill in a couple of areas. But previous transplants have left him with some bald spots he didn't have before, in the areas the donor hair follicles came from.
This area here is from a hair transplant done elsewhere, and there was a lot of tension on the wound. And that scar, as it healed, would gradually spread apart. And you can often get a bald spot right in that area.
But today, the area where the strip of donor scalp is cut on the back of Charles's head is going to be closed using an infrared device originally designed to treat hemorrhoids.
The infrared coagulator creates infrared light that heats up the underlying layer of the scalp. This causes it to shrink, and then you can have a much smaller wound after.
In fact, the wound shrinks by about 50% at the same time that bleeding is stopped, which means that there's much less tension on the scalp when the incision is closed with staples.
If the wound is really too tight, what happens is that it becomes very painful for the patient.
Better yet, because the wound can be more easily closed, it allows for bigger donor grafts to be taken from the back of the head, which means Dr. Katz can transplant more hairs in a given sitting. Charles has had transplants with and without the infrared coagulator, and now that it's over...
I don't feel anything.
Yeah?
Not a thing. No pulling, no stretching.
That's good.
That used to hurt, I remember that part.
Now, the staples that are used to close the donor site in the scalp stay in for about 2 weeks, but they're usually covered by surrounding hair, and so they're invisible. As for the sites on the top where the grafts go in, well, after a few days, they heal, so you can't tell that a person has had a transplant. You can learn more about medical stories on our website. It is located at newschannel4.com. Once again, that is newschannel4.com. By the way, a scientific study on the infrared coagulator just published found that the donor site shrunk by an average of 42%. So hair transplants continue to get better.
And then